Thank you. Good morning, everybody. That's a real honor and pleasure to be here. So head and neck cancer is the sixth most frequent cancer, and it affects around 600,000 patients per year, mainly male patients. This is a disease of misery that did not deserve enough scientific attention from the scientific community. Patients with localized disease can be treated with radiation or with surgery. But around 50 to 70% of these patients will relapse depending on the stage of the disease. And when this disease relapses, we can give sometimes chemotherapy that will improve survival, but after chemotherapy, we don't have much for this patient. These patients also have frequently relapse in the head and neck area, and so they experience many symptoms like pain and swallowing a problem that can have an important impact on quality of life. Also, the median survival of the patient after progressing on the chemotherapy is very low, it's around 3 to 6 months. You all know that on cancer cells, we have some growth factor receptor, and in some of cancer, this growth factor can be activated and can drive the tumor growth. Among this receptor, we have the RB family, so you can see here the different kind of receptor, R1, R2, R3, and R4. And like a personal medicines, we can try to block this receptor with some compound, and the drug that we investigate in this study, Afatinib, is an irreversible inhibitor of all this receptor. So here you have the design of the trial. So patients with incurable recurrent metastatic head and neck cancer who progress after platinum chemotherapy were randomized between Afatinib, so the targeted agent, and a conventional chemo, methotrexate. The primary endpoint of the trial was the progression-free survival, so it was the control of the disease, so the probability of not having a disease progression. Secondary endpoint of the trial was overall survival, and also a quality of life endpoint. Here is the main result. This is the result of the progression-free survival, so of the primary endpoint. The primary endpoint of this trial was met. Afatinib significantly increased the progression-free survival compared to chemotherapy, with a median progression-free survival of 2.6 months. At 12, so if you look at the shape of the curve, here it's the probability of remaining free of progression. You can see that we are dealing with a very poor population indeed, because at the first tumor evaluation, at 6 weeks, we have already 40% of the patients with disease progression. But at a pre-specified endpoint, at 12 weeks, we see that we have more patients in stable disease with Afatinib compared to methotrexate. So showing that in a subgroup of the patients, this drug can have some activity. We have other endpoints in the trial. I have no time to enter into the detail, but the main findings of this trial are shown at this line. What is really important for this population, as I mentioned to you, this population can have many symptoms due to the localization in the disease. It was shown in this trial that Afatinib had a significant delay in the worsening of symptoms, so they delay the apparition of pain, of swallowing problem. They also delay the deterioration in the global health status over chemotherapy. Patients also in Afatinib had less pain over time compared to patients that receive the chemotherapy. Other endpoints, the tumor shrinkage, the response rate, and the disease control was higher in the patient that received Afatinib compared to methotrexate. The survival was not different between the two arms. The treatment toxicity was also acceptable, and we had fewer treatment-related dose reduction, fewer treatment discontinuation, and fewer fatal events due to the study treatment with Afatinib compared to methotrexate. So this is the first tyrosine kinase inhibitor to demonstrate activity and improve patient-reported outcome in a phase 3 trial for this disease. And this compound is now investigated in a less advanced setting, so in the adjuvant setting, in the curative setting. I thank you for your attention.